Today's guest is Hoang Nhu. He is the CEO of Nuoslogic. He's worked at HP, Broadcom, and other startups. He has 14 patents. He has 4 pending patents. His company was named Startup of the Year in the Smart City category by StartupCity.com. He's partnered with Google on his smart access and smart medication adherence platforms, and he is definitely one of the smartest people I've met in a long time.
Hardworking.
Okay, hardworking. Yeah, thanks for being here today. Thanks for being on the podcast and for YouTube also. We're on YouTube too. You can see sort of an assortment of some of the products here that he and his team have created. There's and correct me if I call these any of the wrong thing, or if there's a better name for it, like the video doorbell tag, the hand hygiene system, the Open Me pill bottle, the paw tag, which was named Consumer Technology Association one of the 10 best gifts for Mother's Day in 2019. Talk about some of these products that you have. There's a lot here, which if you're listening on your on the audio version of this, you should check out the YouTube video too, because you'll get a sense of like how many products there are. It's really interesting. But like, what do you feel like is like sort of the flagship product that you guys have right now?
It's very hard to it's very hard to tell. We are moving forward with 3 prongs of our products. But before I talk about the specific of my products, I have to tell what we are doing first.
Okay, sure.
We are an IoT, Internet of Things company.
Okay.
And IoT covers a very, very large number of applications and markets. That's why you can see a lot of different gadgets here. Okay, and our mission is to use wireless sensors to put on existing standalone devices, just like your regular traditional doorbell, or a regular pill bottle or pill box, or your deadbolt lock in front of your house or your garage. By putting wireless sensors on these, we convert them into cloud connected and smart devices. And from these sensors, we collect data to provide unique insights or intelligence on what we call the 4 W's: who, what, where, and when. Okay, and so these become very smart devices, and nowadays everything is smart. Smart home, smartphone, smart car, smart city. So that, I think, is the word smart has been overused too much. So that's why we came up with the word Nouslogic. Nous in English, it's not that popular a word, but it means intelligence or smart.
Okay. I have some of my questions here. I'll just sort of like reference this occasionally. So you talked about that a lot of these products are smart products, but what's the benefit to this? I mean, obviously you have like, for instance, the pill bottle. There's a lot of uses for that. I mean, like we were talking about before we started this, it's like that would be helpful for me because like I can't even remember that. But what are some uses that would sort of be atypical, I guess, or things that people wouldn't necessarily think that it would be beneficial to have like smart technology embedded in that?
Right. If you are in the medical field, medication adherence is a major problem. Okay, people have to go back to the hospital because they didn't follow the doctor's prescription and take the medicine or take them on time. Okay, so with nowadays technologies to have sensors on these regular pill boxes or pill bottles, we can monitor whether the right medication was taken at the right time or not. Okay, and that via collecting such data, you will the doctors or the caregivers from afar, or the family members in particular, to have peace of mind knowing that your loved ones, elderly loved ones, take the medicine on time.
So one of the things too, as I was doing research for this, and we talked about it before too, is the like hand sanitizer.
Oh yes.
Sensor. Talk about that a little bit. That's really interesting.
Before I talk about, I'm very glad to share with you that this coming week, I'm going to work with Connecticut Children's Hospital to install and pilot our hand hygiene system. Yes. Basically, again, it's to put wireless sensors on existing sanitizer dispenser and also on the staff's ID badge. Okay. There, again, it's to monitor who, what, where, and when in the following way. The staff, the nurses, or the doctors wear an ID badge. I don't have it here, but basically it emits a beacon signal to identify who that person is. Okay, he walks into a patient room. Okay, this is basically to try to contain the HAI, hospital-acquired infections. Okay, they are required to use the sanitizer dispenser upon entering and upon exiting the patient room to contain the spread of infectious disease. So the moment he arrives at the patient room, we call it a location hub to indicate which patient he has entered. And that's basically a receiver sitting there listening to the beacon signals from the staff's ID badge. Okay? The moment that the receiver detects his presence, then there's like a timer to count down 30 seconds to give that person the chance to activate the sanitizer dispenser. So we put another sensor on the just a mechanical optical dispenser there to detect the presence of his hand. Okay, and then without such activity or without detecting his hand, then the location hub will emit a beeping tone to remind the person. Okay, so all these activities are time-stamped and uploaded to our cloud server to create a dashboard to show who is not compliant and when and in which room. So all those activities are uploaded via another. The fourth component is basically it's a gateway. We call it communication hub, but it's a gateway, Wi-Fi gateway.
Okay.
So that's how we call it the hand hygiene monitoring platform works. But the interesting thing is using that same exact infrastructure in the hospital, instead of putting the ID beacons on the person, you can put it on the staff, you can put it on an asset. And that infrastructure will become a asset tracking. It will provide asset tracking service. Similarly, if you put it on the patient, then you can monitor where he is in the hospitals, which department is in, and if the queue is long there, then in real time the manager can send more staff to that particular department. Okay. So
let's shift away a little bit from like product and talk about like business. So I read that you initially got funding using like crowdfunding. Right. Yes. So talk a little bit about that. What were some things that first of all, how long ago did that happen?
One was in 2014, the other was 2016.
Okay.
So, quite some time ago.
And so give some people, one of the ideas behind this podcast is to sort of give people some information who are thinking about starting a business or like entrepreneurial people. What are some things that you discovered by going through that process that you didn't necessarily know at the time?
Okay. Marketing cost is very, very expensive. Okay, so I think to be successful, first you have to have a team to execute, to come out with a product, not MVP, a minimum viable product, but a little bit more than that, so you can attract some investors and hopefully buyers. Okay, but the second thing is to amplify your products, and to amplify it costs a lot of money. So crowdfunding like Kickstarter or Indiegogo did help in the past when they first came out, but lately it has not. It is not as good a mechanism to help you with the amplification of your product marketing as much as in the past, and also. To be really successful on Kickstarter or Indiegogo, you also have to spend some marketing money ahead of time to create the buzz, so that when you launch it, people already start to know about it, and then hopefully will back you on the crowdfunding campaign. Otherwise, if you start marketing a little bit late, then it won't be in sync with when you launch the Kickstarter program. It has to be ahead of time. So what I learned is that R&D is one thing, but marketing costs major. So I appreciate your help in sharing this.
Yeah, for sure. Yeah, for sure. Talk about the like Upward Labs and what that is, and sort of like how you became involved with that.
Yeah, this is a very interesting program. I came from, we are based out in California. There are a lot of accelerators, okay? But I told Shanna this is the second accelerator I applied to because it's very interesting. It's not teaching you or training you from the basic, like writing business plan and all that, or attracting VCs, but it's about piloting it. You have to have a real product, and because the program is only 6 months, and you are going to pilot it and test on live people, or in my case, in real hospital, and also in this building, the smart locks that I will talk about next. You really have a real product to start piloting here. So it's that's what is very interesting about Upward Labs. And the second thing is it has everything I need because it has two categories: smart buildings and aged care.
Oh, right.
And I have two, like I mentioned earlier, I have 3 prongs.
Right.
Okay. One is for smart lock and smart access, basically smart access for smart buildings. The second one is for like pill box, pill bottle, and our gateway hub here to monitor all the health activities of the elderlies at home. And the third prong is for hospital products, like I mentioned, the asset tracking or hand hygiene. So this Upward Labs provides both tracks. That's why we found that to be a perfect fit.
Yeah, it sounds like it. Okay, let's see. So which of these products do you think could and will have the biggest impact?
You want to start with a low-hanging fruit or sophisticated one? Very complex.
The whole way.
Okay. Having been with Hewlett-Packard and Broadcom, I've been going through 4 phases of products that are very disruptive, and it took me for those some from 5 to 9 years to wait from the time we conceptualize it and then start the architecture and design the chip and then manufacture it until it reached like Comcast or AT&T or Microsoft. It could take 9 years. Okay, so those are very sophisticated products. Likewise, that's why we have the hand hygiene monitoring platform that requires a lot of different know-hows and IPs, from wireless sensors, low power sensors, to Bluetooth mesh and Wi-Fi, and then cloud servers and apps and the whole 9 yards, from hardware to software. And like I mentioned earlier, it requires 4 hardware components. The ID badge, it's a wearable worn by the staff. The sensor on the existing dispenser, and the location hub, which is basically a receiver, and the communication hub, which is a Wi-Fi gateway. So that's on the hardware side. So software and firmware and apps I mentioned to you earlier already. So that's the sophisticated side. And then the disruptive doesn't have to be sophisticated like that or complex like that. It could be as simple as I would call, this is bragging a little bit, but I think it could be, with your help spreading the words, could be a Ring video doorbell killer.
Okay.
At 2 orders of magnitude. It's cheaper than the Ring.
Yeah.
Okay, it achieves 60 to 7% of what the Ring does. Basically, it allows the remote homeowner to ID the person in front of your house. Okay, it has an active camera built in, and it requires Wi-Fi in the home. It requires wiring with electrical wires or batteries to set up all that. And so it's costly both in hardware cost and installation cost. Whereas this is NFC, which is in your Samsung phone or iPhone to help pay for your Starbucks, for example, using Apple Pay. You just tap your phone on the cashier and it will pay. So similarly, using the same technologies, you can tap on it or For phones that don't have NFC reader, then you can use QR code, use your camera to scan this, and then you can instantly and anonymously get connected to the homeowner to identify yourself before he can either remotely unlock our other product with a smart lock or smart garage door, or if the visitor has been assigned an access code, a digital access code, then he can enter by himself. That code to unlock the door or the garage door. And the third component of this very low-hanging fruit is not only it acts as a video doorbell that can unlock all these hardware devices, but also it acts as a virtual keypad, because most garage opener or lock would have on the outside a keypad. We don't have that. Okay, we have a virtual keypad that pops up on the phone of the visitor. Therefore, we could reduce the cost of our product by significantly, and also reduce battery consumption.
Yeah. Yeah, that's so interesting. That's what I thought was interesting about that video doorbell is like it uses what people already have instead of installing something. Like you have to install, and then it's like 2 years from now it's like, okay, well, like this, I don't need this anymore.
Of course, it does not have a camera built in, so it cannot actively monitor. But still, the bad guy in front of your door. But one key thing that is, I have to point this out, that why the Ring video doorbell is not a good solution, because the camera is built into the doorbell. It's within reach of the bad guy. Usually, it has to be on top, on the ceiling. Okay, so the bad guy, all he has to do is within 2 seconds, he covers his face or whatever for 2 seconds, and he can smash the thing. It defeats the purpose of a surveillance camera. It has to be outside of people's reach.
Yes, most security cameras, like they don't have them at arm level, right? Like for that specific, you can't reach it.
Discreetly somewhere.
Right. Yeah, that's a good point. So you talked about that you guys started in California, and you said that it's about having like a big team. I'm always curious to hear like how people, like the teams that people have around them and how big their teams are. And so talk about that a little bit. Like, is your whole team still in California and you're just out here?
We are based both in California and Orange County, Irvine, California, and also Houston, Texas, and also Saigon, Vietnam. Originally, I was from Vietnam, so I was able to go there and lecture, and then was able to recruit a few good people.
So, do you feel like it's how is it working with like a remote team like that when you're here? Is it hard to like keep, because there's a lot of things going on. Mm-hmm. Is it hard to like orchestrate all this stuff? Do you have people on your team that specifically are like project managers for these things, or you're just sort of like juggling all these balls yourself?
A combination of both, and you have to have reliable people helping you. Yeah, it's very demanding because the time zones are very different, but the return is that you never stop. You can assign your task, and then between Houston and Irvine and Vietnam, you can, it's like pipelining. The work never stops. Right. Yep. So therefore, we can accelerate the progress of our project execution by quite a bit.
So one of the things that I saw is you were at CES and you had someone from Google there, like helping to demonstrate your products. Right. How did you make that relationship? Did they reach out to you? Did you reach out to them? How did that whole thing work?
Yeah, that's a long road. Yes, that's a very long road to have. Luckily, we have the attention of Google because we support Apple HomeKit, the Siri, also Alexa, but also Google. And we believe that we have three types of products that are very of interest to Google. Currently, they are pushing on all three fronts. First of all, of course, their Google Assistant. Okay, and also Google is known to be the data company. They collect data, and via Google search, you can quickly search. Now the next frontier is the home. They want to mine the data in the home. Okay, so we have all these home devices, both in security. Okay, they are trying to compete with Alexa Guard, which is another security platform from Amazon Alexa. So Google is pushing hard on that front, Google Home Security also. And also they have another initiative, which is the Google Health. Okay. I think in a way because they want to compete with Amazon's Haven, the joint venture between the Amazon, Warren Buffett, and JP Morgan. Okay, that's a very big joint venture. Okay, so Google Health is another initiative. So we have, again, a smart home and smart home health products that are compatible with Google Health. And that's why I think they approach us and help co-brand our product at CES in January. And we received the news very recently that, again, they invited us to be part of the branding of Google Assistant at the IFA in Berlin. In Germany on September 6th to 11th. And again in CES in Las Vegas in 2020, in January 2020. Yep, so this is a journey with Google.
Yeah, that sounds awesome. One of the things that talking about CES that reminded me of, I just completely lost my train of thought now. Oh, that's what it was. Talking about CES and other consumer electronics show. What you're working on right now is, obviously you're building up this portfolio of products. But what do you feel like is sort of the pinnacle of like smart city, smart technology? Like, what's your dream of what this business could be?
Yes, I think the end goal is to have smart city. Okay, it composes of all these smart devices, and in different applications, from hospitals to public health to security in the home and in public spaces, and also the quality of the health of all the people that inhabit in the smart city. So, but like I said, the low-hanging fruit is up to now. If something happens in your neighborhood or in your home, there's no simple and cheap way for your neighbors or for the firemen or the police, okay, who arrive at your home to get a hold of you, okay, anonymously. You don't have to publish your phone number, because we talked about everything has to be connected. Okay. People have email or presence on Facebook or Twitter. Businesses have websites. The homes will have the smart locks and all that. Okay, right. Smart things is there. But at the front of the door is a simple doorbell. Currently, there's no simple and cheap solution, both in hardware cost and installation cost. Right. So I'm hoping that this will take off.
Yeah, it's a good idea. I had that problem this very morning, actually. My doorbell's broken at my house, and my neighbor came a couple times, and I was like, I'm working, and I didn't go downstairs, and there was no way for him to get a hold of me. It was good in that particular instance, but yeah, it would be nice. It is frustrating. Well, and then of course I saw him later in the day. But it is frustrating, to not have, because I don't want to have to install all that stuff. You know what I mean? I don't want to have to go through that hassle. But yeah, something like that is a good idea.
And this is not just restricted to your doorbell or at your front door. Imagine putting this on your car windshield. Again, now, in case of hit and run or the car being towed or whatever happens to your car, now people, the bystanders, can just scan and get a hold of you. So I've pitched this to. So Hartford is the capital of insurance companies, the car insurance companies. Right. Yes. So hopefully they will see the need for this in lowering the liability of the car owners. In case of hit and run, for example, people can report, can get a hold of the car owners quickly, so the guy who caused the hit and run will be liable instead of.
Yeah, that's so interesting that we were talking about smart everything, and then something like this was just kind of like low tech.
Very low tech.
You know what I mean?
Yes.
Like it doesn't have to plug in, or there's no battery, or you know what I mean? And it's like so simple that like there's so many applications I feel like for that you know, it's the same for like an iPhone, right? When the iPhone first came out or whatever, it's like it would play music and it can make calls. Now they can do so much more stuff, right? That like people have sort of thought more about it. I feel like this has the same, you know.
I'm glad you are on board. Yes. Similarly, you ask about which one you think is the end goal. That has most impact at the city level. So if we dumb down our smart hand hygiene monitoring platform in the hospital, if we dumb it down, then now in public health applications, such as in restaurants, restrooms, you see signs that employees must wash their hands after use of the restroom, but there's no way to enforce that cheaply.
Right.
Okay, so we could dumb down our sensors.
Okay.
You put dispensers there, and now the employees are being watched.
Gotcha.
Okay.
Yeah,
So 2 years ago, I sent an email to a letter to Chipotle.
Okay.
And at that time, they had a outbreak, E. coli outbreak, something. So they're trying to restore their image in the public's for the public. So I showed them that this is one simple way of showing that you care and you're taking some measures to correct that.
Always like I'm always freaked out about that. You know, when you like see the guy, you like coming out of the restroom from washing your hands, and like the guy from works at the restaurant is going in there, and you're like, oh, is this guy gonna come back and like make my food in a second? Like I don't know. Okay, I have one more question for you. As you started through this process, and, you know, I'll sort of speak from my point of view. Any sort of business that I go into, there is a certain level that I have an idea about, and then things change, and I learn things through, like as I go through the process. So, what's something that you've learned going through where you are now that you wish you would have known before you started? Is there any helpful advice that you could give yourself going back like a couple of years when you were?
It always takes more time and more money to execute than you ever expect. So be prepared for the long haul. So I disagree with nowadays. It's this line is very popular. Like go fast or go home.
Right.
Okay, everybody wants to do that.
Right.
But the reality is that no, unless you are extremely lucky and very well connected, then that can happen. Otherwise, prepare for the long haul and always expect the worst and be prepared for that.
Okay.
Yes.
Well,
So I never thought that all this took me for almost 15 years.
Okay.
Yes. Yeah. All these telehealth thing, I started in 2005 building a team because IoT. I used to work for Broadcom, and the slogan from Broadcom is connecting everything. Okay. That startup, it was a startup in 1992. Okay, so they foresaw all these IoT, and at that time it's called connecting everything. Okay, so I also saw that healthcare needs to be lower cost to be affordable by a larger number of people. So IoT would help that, so telehealth. But it took us 15 years. This is an example of why I mentioned earlier, never underestimate how long it takes you to yes. So we saw this telehealth thing, and luckily this year it started coming, I can see the light at the end of the tunnel. Medicare, starting in January of this year, started reimbursing doctors who installed these monitoring devices. Okay, about $120 per month per patient. Okay. So luckily we have started to implement this for a couple of months at some of our patients. Mm-hmm.
That's great. That's interesting.
It took us almost 15 years from the time when I started that team about 2005. It was our first product was a Bluetooth-based pulse oximeter. Okay. But it was slow. We couldn't compete, so we pivot. Another thing is what I know now is your plan is never the same. You have to be flexible and adaptive to pivot. So that's why I pivot to all these, from smart door locks to go out while waiting for this 15 years to become a reality.
Yeah, that's one thing that I feel like is romanticized a lot, right? The whole thing of just like, I came up with this idea and now I'm like a billionaire, right? Like, that's,
you only hear the success story.
Right, yeah. That's like the old saying is like you're a 15-year overnight success. You know what I mean? It takes a lot of like pushing the rock up the hill to just get some kind of momentum going, right? Let alone like huge company, whatever. But it's real easy.
All those unicorns, they're very.
Right, yeah, I mean, they call them unicorns for a reason, right? Like, unicorns in real life don't actually exist.
Yeah.
But yeah, that's, and it's funny you mentioned that because Jeff, the person that I had on the podcast right before you, basically said the same thing.
Oh, really?
Yeah. And that's it's interesting to hear that reiterated. So,
good.
How can people get a hold of you and find out more about your products?
In Hartford, just connect upward labs. Okay.
Like your website or
Nouslogic.com.
Okay.
Yes.
All right. Well, thanks so much for being on the podcast. I appreciate it.
Yeah.
Thanks a lot for being here.
Thanks, Justin.
Yeah.
Yep.